WMER2 News partnered with GBMC HealthCare to answer your questions about the coronavirus, and we're fortunate enough to be joined by Dr. John Chessare, the President and CEO of GBMC HealthCare. Thank you so much.
Thanks for having us.
Okay, so I can ask you this, not sure if you can answer. GBMC, do you have any suspected or possible cases of the coronavirus there?
We've had 2 positive cases. Patients who came to the emergency department were symptomatic. We tested them. They were positive. They're back home and they're doing well. We have another 10 to a dozen patients now that are presently in the hospital, and we've sent off tests to determine whether or not they have the coronavirus. It's also possible that they could have another respiratory tract infection or influenza, but we don't know yet.
And I think the key is more people are being tested. That's why we're seeing more cases, right?
Well, that's true. We are in the acceleration phase of the pandemic, as we've seen in other areas. It starts out, there's a ramp up, and then we see an increase, and we are delighted as healthcare professionals with the actions of the general public so far. People are following the advice, staying out of crowds, washing their hands, not coming to the hospital just because they have a cold, because the worst thing that could happen is we take a mildly infected person who would otherwise get better and infect the doctors and nurses, thereby us not having staff to care for people when they really get sick.
And that's a concern. A lot of people coming to the hospital or going to the doctor. Tell us about the tents you have outside GBMC right now.
So yesterday we set up and opened our screening tents. So if you come to GBMC, you will be approached by a nurse, and the nurse will ask you what you're there for. And if you're there for respiratory symptoms, you will be escorted into the tent, because we don't want to bring anybody inside to contaminate the rest of the environment.
GBMC, a testing site, or will you be one in the future?
Well, for right now, we're only testing our own patients for 2 reasons. One, as the general public already knows, there is no direct treatment for this disease. And if you have symptoms, you should stay home, wash your hands, take care of yourself, and call your primary care provider if you have any concerns. We only want people coming to the hospital who may need respiratory support.
What about virtual visits?
And another good thing that's going to come out of this is we are doing a lot of telemedicine visits now. I think we did 200 today.
That's wow.
So we are also, we have advanced primary care offices. We have one in the city and many in Baltimore County, and one in Harford County, and our intention is to serve all the people, but to try to keep them out of the office, because once again, if you're mildly ill and you contaminate the whole staff, we may have to shut the office down.
And we don't want that.
We don't want that.
All right, Dr. Chessare, thanks so much for joining us. You can't get higher up at the hospital than the president and CEO, right, Jamie?
That's it. He brought the big guns out today.
We got a phone number for you to call. It's 410-671-0702. Our experts are right next door in Studio B taking your calls about the coronavirus, so get your questions answered. Jamie?